So where do people go if they have a mental health or addiction crisis? Here in London, there's an easy answer. The Crisis Centre. It's the place to go when people don't know where to go. Welcome to the Crisis Centre. The Crisis Centre provides 24/7 support for people struggling with mental health or addiction concerns who do not require emergency services. Our team focuses on a wide range of assessment and counseling services for immediate issues, as well as referral to other services for ongoing support. And it's all only possible through an amazing team of professionals here at the centre, as well as strong leaders, local partners, and government support. It has taken a lot of work to get this far, but we've seen incredible benefits for so many people. Those in addiction or mental health crisis now have prompt support from someone who is more like a primary care provider, who understands their needs and who can stay in touch for their follow-up care. In Ontario, centres like this lower healthcare costs and individuals can expect shorter wait times than in hospital emergency departments. With a strong focus on all these community benefits, the Crisis Centre has grown into an important part of the local healthcare system, not only in London, but in the surrounding region. Let's take a look at how people can access our services. This is one way, by walking into our lobby, which is open 24/7 and staffed with mental health and addiction professionals. Everyone is welcome. No referral is needed. This waiting area also doubles as a quiet space for those who need a break. It's private, comfortable, and acts as a triage so that we can learn more about the person and their struggles and get them the help they need. In this case, they tell us about symptoms of anxiety and depression. So our team suggests that they speak with a counselor on our crisis assessment team. They have a conversation about what they are experiencing, they talk about coping techniques, plans for the future, and community supports they can tap into. The counselor recommends CMHA's concurrent disorder and cognitive behavioral therapy services, which they can register for from their phone. They also give printed information about other community services that can help. By the time they leave, they are feeling more supported, knowing there's help available, and they are always welcome back. Walking in is just one way to access the Crisis Centre. The other way is to reach out. An easy way to do this is by connecting with our crisis line called Reach Out, a 24/7 phone, text, and web chat service. It's for anyone struggling with how they are feeling, as well as their families, caregivers, and healthcare providers. If the support team feels the individual needs immediate help, they are put in touch with the crisis response team. This mobile team helps people struggling with addiction and mental health issues, giving them an alternative access to help and diverting away from emergency services. A team can be quickly deployed for crisis support, risk assessment, and referrals. Individuals who are in crisis might benefit from a more in-depth one-to-one session that the crisis response team cannot provide in the community, so they are driven to the Crisis Centre. Others arrive at the Crisis Centre with the help of first responders. Once they arrive, our goal is to have an individual transferred to the care of the Crisis Centre staff within 11 minutes. This is often faster than getting care at a hospital's emergency department. This way, individuals are getting immediate and focused care for their mental health and addiction needs, while officers and paramedics can quickly get back on the road doing emergency response and public safety work. In this particular case, it's determined the individual needs our team support in a safe environment, so they are welcome to use our crisis stabilization space. This space provides up to 3 days of support for anyone over the age of 16 experiencing a crisis related to their mental health or addiction needs. It has mental health and addiction workers on site at all times who are devoted to helping an individual in their recovery and crisis stabilization. In this case, after doing an assessment with our team, they are given one of our 10 private rooms for at least one night. They have access to a kitchen, a living room, and also a sitting area to meet with a counselor to talk and relax. The stabilization space is a safe space for individuals to get the help they need, both immediate and going through referrals and connections to services provided. After discharge, individuals can utilize this program again if needed in the future. So there it is, the Crisis Centre, the place to go when you don't know where to go. It has shown huge success for the people of London, and with the right government funding, partnerships and leaderships can be replicated throughout Ontario, with each location offering customized services to address the most urgent needs of the community it serves. By providing immediate and ongoing supports for individuals who are experiencing a crisis, we're making their tomorrow look a little brighter. If you need to speak with someone about your mental health or addiction, visit us in person at 648 Huron Street in London, or contact Reach Out through our website, phone, or text. Learn more about the Crisis Centre at www.cmhatv.ca.